What we're going to do is just kind of answer any questions and just kind of give a quick overview of first aid. First of all, we have 2 fully staffed ambulances available for you. First line of defense, call 911. We can show up, we can take care of a lot of stuff for you. In the meantime, you can try to control bleedings, try to render first aid the best way you can. So let's start with worst case scenario. Somebody shows up at your workplace and they become unresponsive. All right. So what's the first step you folks might want to do? There you go. Call 911. Good. That's job security for me, and I appreciate that. All right. So what's the next step? Shake them. Okay. So gentle shake or try to wake them up for school? Huh? There you go. Yeah, we want to wake them up. Try to wake them up. Maybe they just had, like the safety lecture and they might have dozed off a little bit. Or, they have a medical problem. So, want to try to wake them up. What's next? AED. We called 911. AED's on the way yet, okay? What else? Between now and then. Yeah, let's see if they're breathing, okay? Check for pulse. All right, we're going to check for a pulse. So if they don't have a pulse, what's the next step? What are we going to do? While we're waiting for the ambulance, we're going to be pumping on their chest, right, Wayne? All right. So we're going to push deep, fast, right? About 100 times per minute if you were to time it. We're just going to pump on that chest. So what are we accomplishing when we're doing that? Yeah, we're circulating blood throughout the body. And do we have to put a lip lock on this person now? Do we have to blow air into them? No, we're teaching lay folks that you don't have to do that anymore. The compressions alone bring air into the lungs. They found that you're using the chest as like a bellow, if you will. Some of you younger people look it up. Anyway, you're getting air into the lungs and then circulating out throughout the whole body. So what are we trying to accomplish by doing these chest compressions and circulating blood? What are we doing? Yeah, we're trying to keep oxygen going to the brain, okay? Because if the brain goes without oxygen for a certain length of time, all bets are off, right? All right, so now the AED shows up. Now we have put AEDs in the town office. There's one right across the hall here. There's one going into the library. You got the case up there and everything else?
Not yet.
Oh, come on, dude. All right. As soon as that case is up, you get your AED. We have them in all of our fire trucks, our ambulances. We have them spread out around the town here. We have one at New Begin as well. These AEDs will develop a shock and shock a person's chest. You kind of jumpstart the heart, if you will. All right? Now, anybody can use those that have been trained to use them, and they're pretty simple. You open up the case, you put the stickies on the person's chest, and stop compressions. Let the machine analyze the patient, and then if it senses that it needs a shock, it's going to tell you to shock the patient. So is there any precautions that you need to take when you're shocking this person?
Don't touch them.
Yeah. Don't touch the person. Because that electricity will go through the patient and into you, and now we got 2 patients. And I get confused. Who do I say? I don't know. So yeah, make sure nobody's touching the patient. You also will need to remove the clothing to do that. And if they're all wet, you need to dry them off. And there should be a small disposable razor inside, a little case that's inside with the AED. So if you've got somebody that's really hairy-chested, you're going to have to just give them a couple swipes with that razor to take the hair off. Now, if they're not responsive, you shouldn't have to worry, okay? If they start, giving you a hard time because you're shaving the chest, you may not need the AED, okay? So see how that works both ways. All right. So you deliver the shock. Now what do? We're still coming. Yeah, continue with CPR. Who said that? Atta girl. Give her a raise, will you? All right. Yeah. No, we just go right back into compressions. Right back into compressions. If the person pushes your hands off their chest, you can probably stop. Okay. That's a good, yeah. They changed everything and made it really simple now, okay? Really simple. So that's the CPR thing really quick, in a nutshell. Questions on that? All right, I saw there's a poster in the kitchen area here, and we have them kind of scattered around the town. You'll see them at restaurants, you'll see them all, kind of telling people how to deal with somebody that's unresponsive, doing CPR, and what an appropriate place to put that, in the kitchen, right? Yeah. So what else goes on with somebody, okay, that goes down, they're unresponsive? What else? They could be choking, okay. So how do we recognize somebody's choking? All right. I have been doing this for over 30 years, okay? And I've seen choking patients, and none of them are doing this, okay? I would suggest to you, though, if you're choking, you go to McDonald's and you start choking on your cheeseburger, do this because somebody's going to say, hey, you're choking. But most of the people I have seen choke don't do this. Where do they go? Bathroom. Into the bathroom, okay? Or the safe room, if you want to call it that, okay? So they go into the bathroom, they just quickly bolt into there. Now, something's going on. You don't know if they're choking or they have some other sort of emergency, but somebody needs to go check on it. All right, so you come up to the person, now what are you going to do with them?
Ask if they're choking.
Ask them if they're choking. Good enough. Okay, you're going to ask if they're choking. It's a pretty simple thing, right? All right. And if they can whisper, yes, I'm choking. Are they choking? No. They're not choking, they're faking, right? All right, now what it is a partial obstruction. Stay with them, okay? Don't just turn them off and say, hang on, right? Stay with them, okay, and make sure 911's been called. Because that partial obstruction could become fully obstructed, and now we've got a big problem. But what if they can't talk at all? Okay, are they choking? Yes. People that are choking can't cough, they can't talk, you're not going to hear any sounds, nothing's coming out. So what are you going to do with them? The Heimlich maneuver. All right, who's my volunteer today? Okay. Yeah, Cameron, get up here. Come on, buddy. Come on. Come on, that up, boy. All right. Hey, guys, for the people that have not met him, this is Cameron. Cameron is a student at SMCC. He's taking fire science. Going to be living with us for 2 years unless he screws up. Okay? So, stayed by the fire station, and he is taking fire science and EMS classes, and is going to be running with calls with us. Okay? So, welcome, Cameron. Okay? These are the guys. All right. So, I come up to Cameron and say, are you choking? And you nod your head. Okay. So, what do I tell him? Yeah, I'm going to help you. Okay? Tell him what you're going to do, okay? Because it's going to look a little weird to him. What I'm going to do is I'm going to come around behind him, and I'm going to find his belly button, okay? Right around here, right around the belt line, okay? And then I'm going to squeeze inward and upward really hard, okay? Now, I'm not going to do it really hard because I don't care what he had for lunch. I don't want to see it. All right? And it's pointing right towards them. Bad idea. All right, so anyway, inward and upward until either the stuff comes out and he starts breathing, or what's going to happen if he doesn't get air in? He's going to pass out. So see where my foot is? I got him. He's not going anywhere. Okay, he's just going to slide down my body. All right? So that's kind of important. You don't want to just drop. That could be another whole problem. All right, good. Stick around. All right, so that's a Heimlich maneuver. Okay, that's pretty simple stuff. Anybody can do that. Talk to the patient, tell them what you're going to do. All right, and we're going to do that. Again, inward and upward, and until that object comes out or they pass out. Okay. In the meantime, somebody's called 911, and we're going to be coming, and we're going to be able to do some stuff to them too. All right. That's a conscious choking person. Any questions on that one? All right. So let's just say, for the sake of argument, okay, that he's put some weight on, okay? And, yeah, I know I demonstrated with you last year. I'm going to not pick on you or Stevie this year. All right, so anyway, I'm going to do the Heimlich maneuver, but I can't get my arms around his belly. He is big, okay? What I can do is I can come underneath his armpit, and I can find his chest right here, and inward and upward, okay? Just kind of, do you hear that noise? Listen. That's air coming out of his lungs, okay? when, she's really, in the third trimester, and, her belly's really big. Being down here doing abdominal thrust is not gonna be effective, and it can also hurt the baby. So up high and squeeze inward and upward. Modesty goes right out the window, folks. You gotta save her, okay? If you don't save her, you're not gonna save the baby too. Okay? All right, questions on choking? Moving right
So
along.
after they go unconscious and fall to the floor,
Okay.
they still have something lodged in there.
Right, and what I'm gonna do is I'm gonna do chest, good question, I'm gonna do chest compressions to them. Okay, I'm just gonna change my position. All right, good question. All right, yeah, see, that's what I get good at, you keep track of me, it's just good. All right, so that's that part, okay, questions on that? All right, so let's talk about the next step. Somebody's bleeding, okay? Somebody has cut themselves, they're bleeding, okay? Wink ran over with a lawnmower, okay?
Hold on a minute, let me go get my gloves.
Yeah, we're gonna wear gloves, okay? How do we control bleeding, folks? Yeah, just pressure, okay? Now, ideally, you get some big, thick gauze pads, you throw them on there and hold it down, right? Okay. What if you don't have gauze pads? Yeah, paper towels, a rolled up shirt, anything like that, okay? Because right now, you gotta control that bleeding. All right, we'll worry about cleaning it out later, all right? If it's Mike's shirt, you might not want it, have too much grease on it, stuff like that, but that's all right.
Don't have to worry about that.
Oh. Maybe I was looking at
You don't remember where it's coming from, that's all.
Yeah. All right, so, direct pressure, just push down and keep pressure on that. So what if the blood has soaked through that, what are we gonna do? Throw another one on top of it. Don't take that one off, just keep putting stuff on top of it. And obviously somebody has called 911 so we can get there. We've got tourniquets, we've got this special powder that we can put in that clots up the blood. We got all kinds of toys. We've got ways of taking care of that. All right, so that's a bleeding thing. All right, questions on that? Now, when you get bleeding, sometimes the person goes into shock, right? They get losing up blood, or just a sight of blood, they get a little lightheaded, okay, like I did a little earlier. I'm sorry. Anyway, so how do we deal with somebody in shock?
Elevate their feet.
Yeah, we can elevate their feet. That gets the blood that's in their legs down into the core area, and more importantly, up into the brain, kind of circulate. We want to keep them warm, okay? We want to dry them off if they're wet, if they've been down to the Wilkes Beach. Want to try to dry them off and everything else. And again, call 911 so we can come and take care of them. All right? Good. All right. Some of the other things that happen to people, diabetes. Okay, now, we have several levels of diabetes. We have diabetes that is controlled by medication, and some diabetes just controlled with diet and exercise. Okay, so we don't know. Sometimes somebody just comes in, they may start appearing to be intoxicated. One of the ways that people are talking to us when they have a diabetic crisis is they slur their speech and they have a fruity odor on their breath, and you think, well, geez, this person's been drinking or something, but it might not be the case. They may be a diabetic. So ask them, are you diabetic? Okay, if you have somebody that has what we call an alter mental status, they're just kind of really confused and not able to make sentences to you or make sense to you, you can ask them. Look for medical alert bracelets and that type of thing to identify them as a diabetic. So, what do you suppose you want to do with a diabetic if they're having some sort of crisis? Give me a call. Okay, that's first step. All right, what else? What else can you do?
Ask them if they take medication.
Yeah, you can ask them if they're taking medication. If they can tell you that, that's great. All right. The thing that these folks most likely will need is sugar. Sugar. So when we go to somebody's home that's having a diabetic crisis, if they're conscious enough, we start putting together sugar and water or sugar and orange juice, that type of stuff, and let them drink it. If they can swallow it, great. Okay, it's going to save them a lot of trouble down the road. So I have several friends that are diabetics, you'll see in their glove compartments, they've got these bars, they're made for diabetics, to give them a quick sugar fix if they need it. But again, the important part to that is, if you have a diabetic, they're having a crisis, make sure they can swallow. If they're unconscious, don't put anything in their mouth, okay? Now we gotta do the choking thing, okay, if we do that. So, just check on that, all right, and check the medical alerts. All right. Questions on diabetes? Kids, by the way, that are diabetics are the hardest ones to control because they're active, and when they're active, they're burning up all the sugar in their body, and they go down quickly. All right, so the people at the rec department, know who your kids are, and if you know of any of them that are diabetic, kind of keep a close eye on them because they may be the ones that will present a problem. Catch it early, it's an easy thing to take care of. All right. We have folks that have allergies to different things. Most people think, bee stings, okay? That's only one type of allergy. There's all kinds of them out there. There are allergies where somebody just get kind of hives, they get kind of red on their skin, they start itching. Stevie's got, something going on there. Anyway, that's minor. But somebody has like an allergic reaction to a bee sting will sometimes have a difficult time breathing, and what's happening is their lungs are actually filling up with histamine. It's a body's reaction to the toxin in a bee sting, and they need immediate help from EMS. So again, you give me a call, we're on our way. In the meantime, what you can do is if they have an epinephrine pen or an EpiPen, you can help them, just where is it? It's in my glove compartment. Okay, go get it. Now, EpiPens are designed for the patient to use for themselves. But if some bystander is there and we're probably, a few minutes out, certainly go get it for them. You can help them do that. And what they'll do is they'll inject this right into their thigh. It goes right through the clothing, right into the muscle of the thigh, and they hold it there for about 10 seconds. And what that does is it injects epinephrine into their body and counteracts the toxin like bee stings or whatever toxin that they're allergic to. Okay? So we can help them with that. And again, Parks and Rec, if you've got kids that have EpiPen, again, keep an eye on them guys. They may or may not be able to use it themselves. They may need some help, some coaching or something like that to do.
So we can do that to a child?
You can help. You can help. Yeah, that's the key.
You always told us to call you
Yep,
first.
call us first, get us started, all right? Yep. For the most part, we are staffed all the time and everything else. However, if we're out on a call already, we may have to call into Gloucester, Wyndham, Raymond, somebody else to come in to cover us if we can't get a truck out to the barn. So it's always a good idea to give us a call first. We might show up and, everything's under control and we just turn right around and go back to the barn. That's okay. We're fine with that, okay? So yeah, always give us a call on any case like that. We don't mind. All right. You may have somebody that has an injury to an eye. Okay. Don's been out weed whacking and didn't. Somebody got something in the eye or whatever. How can you deal with that? What kind of first aid you gonna do when somebody get an eye injury? Yeah, you flush it out, okay? You can take some clean water or something like that, kind of flush it out. You want to kind of tilt the head to one side. My eye here is bothered. Just kind of tilt the head down a little bit on this side and just pour it right from the brim of the nose and right across the eye there and kind of flush it out. Again, we have in workplaces, public works and in public safety. Do you have one in your place at all, Ed? An eye wash? Yeah, bottles. Okay. Those are available for, if you're working on radiator or battery acid or something like that, and that's splashing up in your eyes, that's a bad day for you guys. Certainly you want to use that eye wash station to do that. And again, give us a call. More than likely, you're not going to be able to see, so you're not going to drive yourself to the hospital. We're going to take care of getting you there. All right? Yes?
Sometimes we get stuff in my eye works really well if you're out in the middle of nowhere. You have a really full
Yeah, it's kind of an eye wash type of thing, yep, yep. They actually sell a little cup you can do that with. It helps flush that out and everything else. If it is an acid type of thing, you wanna make sure it doesn't get in your good eye, okay? So if you got it in one eye, that's bad enough. But when you flush it out, make sure it doesn't splash over and get into the other eye, because now you got double the trouble. Okay? All right. So, those are some of the things that we see routinely. Questions? Any sort of medical types of issues or anything like that that you might have dealt with?
What do you do with eye puncture?
An eye puncture? Yeah, eye puncture, it's, all right, all right. Yeah. You gotta understand, his brother, does work for Marvel Comics, okay? So he gets a lot of his ideas from his brother. All right, anyway, eye punches, yeah, it does happen. I haven't seen a whole lot of them. What we'll end up doing is we actually take like a styrofoam cup and put that over the eye, and the other eye gets bandaged too, because when I move one eye, what happens to the other eye? It moves too, right? So if I bandage both eyes, they stay still. We don't want the eyes to move at all. So first aid wise, you have to be still. Good luck. All right. And then give us a call. We're going to come. We're going to bandage them up that way and everything else. And now they can't see. We're going to get them onto our stretchers so they don't have to walk. And then we're going to get them to the hospital. Reassure them as much best you can and everything else. But it doesn't happen that often, but it does happen. And when it does, it's, again, just keep them still, give us a call. Okay? All right. Great question, though, really. Yeah. All right. What other questions we got out there for you guys? All right. All right, Wilkes Beach, you guys. All right, fish hooks.
Fish hooks.
Yeah, all right. Have you seen somebody get stuck with a fish hook yet?
Yes, I have.
Okay, all right, because you will. All right, it happens all the time. Again, remember there's a little. Oh, it's been late, ain't it? All right. For the folks that didn't hear that, somebody said fish hook in the eye.
I've seen it.
Thanks to our librarian over here. All right.
Josh for asking.
Yeah. All right. Josh is great around Halloween time too. You got any ideas you want for Halloween? He's down. All right. Anyway, yeah, fish hooks. The trouble with fish hooks is they got the little barb on the end, so it stays with the fish. If you try to rip that out of somebody, and it's going to do a lot of damage to the tissue. So more than likely, it's better, give us a call, or they need to go to at least a quick care, maybe a hospital to have it surgically removed, depending on how deep the thing is in the tissue or anything like that. But in the meantime, you're going to control bleeding, all right? And if it's somebody that's a little squeamish, they're probably going to need to be reassured. And I've seen grown men. I've been on fishing trips where they get a fish hook in their finger and they just go, oh, they get a little lightheaded. Right, Dean? Okay. Anyway. I don't know. This is recorded, isn't it? Keep forgetting. All right. So anyway, any other questions out there? First aid wise? No?